Hi guys, so I want to read this tweet from Dr. Samantha Batrodden. She's a senior intensive care registrar in the NHS. Now she retweeted this message from another person and it says, an urgent appeal has been sent out across London for NHS hospitals to send staff to help London's Nightingale Hospital open next week. Now what the government are trying to do at the moment is, because of the pandemic, the massive number of new cases, the hospitals of the NHS are risking to be overwhelmed. So they are reopening or opening the Nightingale hospitals that were set up during the first wave of the pandemic. The problem with the Nightingale hospitals is that there aren't the doctors and nurses to staff them. Why is that the case? Well, the doctor here, Dr. Samantha, explains why. So she says, we tried, we really did. We warned repeatedly of critical staffing levels before the pandemic, and yet we had. And then she says the nursing bursary axed, junior doctor contract imposed, years of NHS pay freeze. These decisions were a gamble, and ultimately it's our NHS that has lost. Now what she's talking about here, I'm going to go into a little bit of detail, but these are decisions that were taken over the last number of years, and also recently by Boris Johnson and his government, to defund the NHS, not to provide it with the right funding, not to hire enough staff. And I believe it was to, in a way, to weaken the NHS to an extent where people would eventually go privately. And it would be possible for the government to eventually just sell off the remaining parts of the NHS to the private sector. But let's go into detail about what she says here. So the first she says here is the nursing bursary axed. So I want to show you this report from The Guardian from last year. It says here, more than 15,000 second and third year nursing and midwifery degree students have opted in to fight the pandemic, helping make up for the 40,000 shortfall in nurses in the NHS. Now this shortfall is because of the Tories over the last 10 years deciding not to encourage people to join the NHS. Once again, I believe it's because eventually they want to sell it off. So they don't want to fund the NHS sufficiently in order for it to operate correctly. All will be graduating with huge debts, in many cases nearly £60,000, the result of the government's decision to scrap the NHS bursaries. To add insult to injury, those graduating this year, this is in 2020, will have missed out on the new £5,500 a year grant towards living costs that the government is introducing in September to try to boost falling recruitment. Now, what the government were doing last year was attempting to throw money at the problem, but you can't fix a problem like this by just throwing some money at it. There have been years and years of underfunding and under-recruitment that have caused these problems. You can't fix them overnight. So let's look at the second problem she talked about here is the junior doctor contract that was imposed. Now, I just want to read, this is from Full Fact. I use this website from time to time. I just want to read this part here. This is from 2015 when this new contract was implemented. No, I don't know if something has changed and it has been updated since then, but this is the latest data I can find on it. It says here the junior doctor's latest reaction. So junior doctors voted in July 2015 to reject this contract. Following a survey of junior doctors on why they rejected the contract, Dr. Ellen McCourt, chair of the BMA, the British Medical Association, Junior Doctors Committee, set out 4 main areas of concern the BMA want the government to address. So these issues were the protection of junior doctors who raise concerns at work, the guardian of safe work role, terms and conditions for junior doctors working less than full time, and how weekend working is treated. So the junior doctors are not happy with the contract that they have, and they would like that changed. This was requested by the junior doctor and the Medical Association, but the government ignored this. And then finally, we come to the issue of the pay freeze. Now, we've heard about the pay freeze before. This is from the Nursing Times website. It says here, Hancock reveals 2021-2022 pay rise for nurses will be unfortunately delayed. Now, this is from last December, so it's just about a month ago. The article says Health and Social Care Secretary Matt Hancock today wrote to the NHS pay review body to formally begin talks on the 2021-2022. However, he said the timing of Chancellor Rishi Sunak's latest spending review, which was delivered last month, meant the process had been unfortunately delayed. So, I've said this before. The Tories will not put their money where their mouth is. They will say in Parliament, yes, we're looking after the NHS, we care about the NHS, we're funding the NHS, we're pumping loads of money into the NHS. But what is important is to look at the results. Is it working? No, it's not. Why is it not working? If nurses don't have the sufficient funds to conduct these courses, to complete these courses, they're not going to complete them. Many nurses are afraid of the massive debt that they'll incur by getting involved in these courses, by starting them, so they will avoid them. The contracts that are available for junior doctors, are these contracts negotiable? Is it possible to have it changed? What are the terms and conditions of these contracts? And I think the final one, of course, the pay freeze. If the government are saying at one stage, yes, we care about you, we need you, we need your help, and then when it comes to the moment where the government actually are going to pay for it, and they say, well, we need to review it, or unfortunately we can't do it this month, or we can't do it this year. How is this encouraging people to rejoin? You know, when it comes to money for contracts for private individuals or private companies to supply PPE, the government doesn't have a problem with throwing money at that. They don't care about the cost when it comes to spending money on things that are useless. I'm not talking about the pandemic, I'm talking about other things. There's not a problem with spending money on that. When it came to Brexit, for example, there was no concern about the cost. When it came to the propaganda campaign of Brexit or any other issues, what was it, £10 million was spent on a coin. Tens of millions of pounds was spent on getting companies ready for Brexit back in in October 2019, when Boris Johnson actually had to extend. Even though he knew he had to extend, he still spent the money. So when it comes to spending money on stupid things, the government doesn't have a problem. But when it comes to spending money on the NHS, spending money on staff, spending money on wages, then I'm sorry, there's an inconvenience. I'm sorry, there's a problem. This is all part of a bigger plan to undermine the NHS, to eventually have it sold off, bit by bit, of course, not immediately, but to sell off parts. Because if the general public have, at the moment, the general public have a very positive view of the NHS. But if people start to have a negative view, then it's much easier for the government to sell it off. This isn't working. Hand it over to the private sector. People are facing queues and delays on this. Sell that part off to the private sector. The private sector are more efficient. They're more cost effective. This is the type of rhetoric they will use, and they have used it in the past. So, going forward, it seems that the Nightingale hospitals are going to be reopened, but who is going to fill them? Who are going to staff them? Because there aren't the people available. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. I want to say a big thank you to all of my patrons. You ensure that this channel continues to exist. I'm eternally grateful for all of your support. If you join Patreon, you will receive instant access to our Discord server, where we have both audio and video chats. You can chat with me and other patrons, where we discuss important and non-important issues. Becoming a patron per month costs about the same as a large coffee, so why not check it out?